We'll start with taking attendance.
Thank you, Mr. Chairman. Fine. He's here. Simpson. Cleary.
Here.
Epicoro. Andrew Joyce.
Here.
Miller.
Present.
Rosano. Here. Lockhart.
Here.
And Pearlie.
Here.
You have a quorum.
Thank you. Okay, first order of business is previous business, approving the previous meeting minutes. We have a motion. Mr. Miller. Second. Ms. Rosano. All in favor?
Aye.
Opposed? Passed unanimous. Okay, now on to current business, number 2 on the agenda. I'll let the majority council
You're
read.
going to have to do it because mine are up.
Okay, I'll read it. Authorizing the acceptance of grant funding and agreements regarding the Family First Mobile Response Initiative and amending the 2024 Department for Children, Youth, and Families budget. Commissioner?
How are you tonight? Good evening, everyone. So this is actually the Families First. It's put in place by the Office of Children and Family Services to prevent youth disrupting out of either a kinship family or any type of foster care placement that we have them with. It's really to look at what are the child's needs, what are the family's needs, so we don't disrupt. It is staffed by a clinician, a domestic violence advocate, a peer specialist, and they've been operating now for about 8 months.
Thank you. Is
And
this,
Trinity has the contract with OCFS and with us to provide this.
and is this a new program as of 8 months ago?
Yes. It was actually last year's funding, but it took them a while to get on board staff.
So I see it's state funding, so is this something that's being done statewide?
Yes, well, actually, there's only 5 counties that it's really a pilot project at this point. So this also supports the cost of a Winnebago that is provided by OCFS.
Great, I'm glad we got to be one of those 5 counties. Did we take initiative and apply for that? Is that how we?
Yeah, they reached out, and we just did a proposal, and were awarded.
Great. Are there any questions from the committee?
Mr. Pearlie.
Oh, sorry, Mr. Pearlie.
Thank you, Mr. Chairman. Commissioners, is the idea of a Winnebago, does it actually provide housing if it's necessary in the situation?
No, it actually does a lot of outreach, so that is full of resources for families. And it would also be like, we put pack and plays in there, diapers, food, and they go around to various locations. Like they've been up at the Hilltowns at Burn Knocks Westerlo, they've been down in Cohoes, they have been to South Colony Raider Fest. They also go to pediatricians' offices. That way we can help support not only the community, but parents that may be struggling.
Are there any other questions? Do we have a motion? Motion, Mr. Cleary, second. Ms. Rosano, all in favor?
Aye.
Opposed? Passed unanimous. Okay, now moving on to number 3 on the agenda, authorizing an agreement regarding the Children's Advocacy Center Child Fatality Review Team and amending the 2024 Department for Children, Youth, and Families budget.
Thank you. Yes, we didn't think we were going to be receiving this money, but at the last minute, OCFS has awarded us the grant. And this is a cross-discipline team that really reviews every child that dies in Albany County. So they look at, what were the causes, where can we do preventive work, and this team has been around at least about 15 years.
Great.
At least.
And so we've been doing this program for about 15 years now?
Yes.
And do we have, is there data or report on the findings?
It's very sensitive information that needs to be held confidential. I could see if there's anything regarding the cause, such as safe sleep, if they were co-sleeping together, or if it was, a child being hit by a car. But I would have to look at that. But there can't be any identifying information.
Okay, yeah, I understand that. I was wondering if there's like aggregate data of this is how, this percentage or this number of children died in this way, or recommendations on, what we could do to try to prevent child deaths based on the data.
Right. And, and we do a lot of safety campaigns, like the summer one is coming up, and it's bike helmet, water safety, and of course, we do the safe sleep in the winter, because oftentimes babies suffocate in their cribs.
Okay, thank you. Are there any questions? Ms. Lockhart?
Just a comment, Mr. Chairman, what you're asking about. That was part of the mandate of having the Child Fatality Review Committee, was to not only look at cases where child deaths were, but then how to prevent it. And out of that, I remember when I first started, we did the Child Fatality Review with co-sleeping and all the problems brought, kind of pack and plays, so that, and went to hospitals and identified people that were in need. So you're right. It's not just it's looking at cases and seeing how to investigate them, but also to improve on any problems that might be out there.
And I can say the Office of Children and Family Services still provides us cribs annually.
Yes.
So we have, I think, right now on hand about 250.
Yeah.
And we really get all that out to the community.
Yeah. Good program.
Mr. Purley?
Thank you. So this is not just children that are in the county's care that die. This is any child.
Any child in Albany County.
And when it says reviews, I mean, are people obliged to
We have a
participate? Or?
group of team, and they sign MOUs that they will participate as a multidisciplinary team. And then whatever information, for example, law enforcement will bring records that they have related to it. We have a contract with a nurse that does the actual, if it was sexual abuse, the actual exam, or get the medical coroner's data from there. So it's an opportunity for everyone to brainstorm on the situation.
But if my child tragically died, God forbid, of disease or what have you,
We would review that.
you review, but would I have to participate or would a
No,
parent have to
no, no.
participate? Okay, so
A parent
it's a-
does not
it's a-
participate.
Okay.
Right.
They don't participate.
Okay, I'm thinking of a situation in which a trauma would be extended by
Oh,
having
by
the government show up and say, tell us what happened.
It's really so that the staff and the people that are investigating this do a better job of this.
Right.
Because there's a lot of unique things that happen in those cases.
And to ensure we didn't miss anything.
Right.
If it was an open CPS case.
Thank you.
Are there any other questions? I'll just add, it seems like an important program, and from what
It is.
Ms. Lockhart's saying, it looks like it's been helpful in the past in helping us make improvements to prevent death. So I would be interested if there's anything that can be shared. Of course, I understand sensitive information, needs to be kept sensitive, but any information or data or recommendations that can be shared with us, I think we'd all be interested in seeing that.
Great, I will get that for you.
Thank you. Do we have a motion to approve?
Make a motion.
Ms. Lockhart, second. Mr. Miller, all in favor? Opposed? Passed unanimous.
Thank you very much.
Thank you, Commissioner. Oh, actually, Commissioner, we have one more item. We're going to take it out of order, but number 5, I believe. Is that you, even though it says...
Because that's with
Okay. It says Department of Children. Okay, so we'll move on to number 4, authorizing an agreement with Cornell Cooperative Extension regarding the Home Energy Assistance Program.
Yes,
Commissioner.
good evening. This is a renewal of an agreement with Cornell Cooperative Extension to be our HEAP certifier for the next season, 24-25 season. They've been doing this for quite a few years for us, and we are required to have an outside non-DSS certifier to help people in the community learn about HEAP, sign up for HEAP, answer questions, and that kind of thing. They do outreach events, and then they help people who have difficulty filling out the applications. And last year, they did over 2,000 applications for us and handled 4,500 phone calls, which is a nice help to everyone. And this is a $180,000 contract with, unfortunately, an 80% county share.
Thank you. Do we have any questions from the committee? We have a motion to approve. Mr. Miller, second. Ms. Lockhart, all in favor? Opposed? Passed unanimous. Okay, number 5, authorizing an interdepartmental agreement between the Department of Children, Youth, and Families and the Mental Health Department regarding adult protective services.
Yes, this is an MOU we're requesting to enter into with the Department of Mental Health for our adult protective services. Shared clients that we both share that have hoarding problems in particular, and the condition of their apartment or home might be a reason they may be evicted. So we are entering into an agreement with mental health for $50,000 of an ARPA funding that Adult Protective received to do cleanup and if there are bugs or anything like that, pests, to help clean up the apartment so that it doesn't put the individual at risk of eviction.
Thank you. Do we have any questions? Ms. Lockhart?
Commissioner, I'm familiar with the county has always kind of gone in with the hoarding and trying to help people with services and stuff. I understand it's a pilot program. It says $5,000 per person for cleanup, I think, a cap.
Yeah.
How many times would you go into the same house? Because this is a reoccurring problem. I know
Yes.
once you clean it up, within 6 months with hoarding.
Yeah.
I mean, that's a whole very difficult mental
We
illness.
don't expect to duplicate any services with this particular grant. This is kind of to see how it works and whether we can then do an intervention afterwards to keep the apartment cleaner. But this will, there won't be any duplication in this. We have to spend this by the end of September, I believe, so we don't have a lot of time anyway. So we'll do only separate individuals.
Just a follow-up to that. Has the Department of Mental Health, and I'm not aware, but, or are you aware that there is any new therapeutic dealings with how to deal with hoarders?
There's
It's a
very
frustrating
little,
situation.
there's very little methodology that's really become available, even as long as it's been around and we've become aware of it. It's a huge problem for a lot of, not a lot, but a subset of our adult protective clients, and the reason they're getting in trouble is because they have hoarding issues and their family has given up on them.
But it's a big problem, not even in the adult protective. I mean, I don't care whether it's Loudonville or the Village Colony.
Yeah.
There's a lot of issues with that.
It's a common
We haven't gone
difficulty.
any further. I was hoping you were going to tell me, oh no, there's some new studies out there that.
Well, mental health is going to try to work with these folks too, but there's not a lot of evidence-based interventions, I don't think.
Thank you, Commissioner.
Mr. Purley?
Thank you, Mr. Chairman. Commissioner, you mentioned apartments and people facing eviction. What about people that live in single-family homes that have issues with code enforcement?
Yep, if they're a shared client with adult protective and mental health, it'll be available for them. One of the outcomes, most of them don't own their own homes though, most of them do live in rentals.
Ms. Rosano?
Hello.
I understand this is a pilot program, but have any of the maids or any of the cleaning services have been made aware of this and will be eligible to provide the personnel to do that? Because some of the stuff that's listed is a pretty nasty job.
There's only very few businesses that will provide this service to us. And we have a few relationships with a couple providers. But yes, there's not a lot of businesses stepping forward to want to do this kind of work.
Thank you.
Are there any other questions? We have a motion. Mr. Purley, second. Ms. Rosano, all in favor? Opposed? Passed unanimous. Okay, number 6, authorizing an agreement with Salient Corporation regarding annual maintenance and user licensing costs associated with Salient data mining software.
Yes, we're requesting to re-enter an agreement. We've had a relationship with Salient data mining software for a couple decades now, primarily for our fraud investigative activities, looking at providers and the expenditures that providers are experiencing in Albany County and allowing us to look deeper at what is going on. They also they're the only provider that New York State OTDA and DOH allow into their data, to pull from their data and take a look at these expenditures and trends. We also use it for budgeting purposes to look at the expenditures for safety net and TANF and to determine kind of where we have been and where we're going, and to be able to project kind of our future needs and costs also. So this is a 3-year contract. We get a better deal if we do a 3-year contract with them for $128,000, and it's 100% covered by federal reimbursement.
Ms. Lockhart?
Lots of questions
50
for
minutes.
tonight, Commissioner, I apologize. I'm very familiar with Salem, I think it's about 20 years, and it's...
Yeah, couple decades.
A good software usage. You were saying providers, are you talking about it just for providers or for the people that receive, benefits and so forth?
Mostly providers we look at, but we also can do some looking at case data and how much we're spending per case type, for instance. We can do that kind of through this.
Do you have any data on how much we've recovered or number of arrests we made for people that are running the county?
Yes, we have annual, we have quarterly reports on our fraud activities. Medicaid has been a little slower recently because we rely on OMIG, the Office of Medicaid Inspector General, and they have been kind of slower to do the final act, kind of. We do the investigation, others must do the arrests and the prosecution.
And the recovery?
And the recovery, right.
Which is probably, you're saying it's slow? Recovery.
It's been, in the last couple of years, it has been, since COVID, really, but we're still doing it, we're still looking at it.
Long before COVID, I think.
Yeah.
Thank you.
Thank you. Are there any other questions? Do we have a motion to approve? Mr. Cleary, second. Ms. Rosano, all in favor? Aye. Opposed? Passed unanimous. Okay, last on the agenda, number 7, authorizing an agreement with Ventec Inc. for annual maintenance of supplemental nutrition assistance program software and development of software workflow programs and amending the 2024 Department of Social Services budget.
Yes, we're looking to authorize, enter into a contract with Ventec. We already have a contract that was adopted last year for them to develop a software for tracking SNAP applications, processing. And this we want to add just for an annual maintenance contract so that we can, continue the service, and then also to add on the development of a form that we're going to be able to use for supervisors to take a look at kind of where all cases are, where they are in the process, and for instance, if they're coming due for recertification tomorrow and somebody hasn't taken action, they'll be able to see that and then assign it to someone to take action. And this will allow us, right now we're using paper to assign work in SNAP. You have a log that you receive every day. This will take care of it and will make it all electronic. People will go onto the software website. And this is also the only company in New York that OTDA has agreed to allow to have access to that kind of information on our cases. They're based in Schenectady, actually. And we'll be able to develop a list of all the cases and where they're at, if they need documentation, if they miss their interview, whatever it is, and then supervisors will be able to assign that work much quicker and more efficiently than writing it out on paper and passing it on to someone. So we hope this will help us at least manage the workload a little better.
Great. Do we have any questions? Do we have a motion to approve? Or is that a question? Or motion. Okay, motion to approve. Mr. Miller, second. Ms. Rosano, all in favor? Opposed? Passed unanimous. Okay, do we have a motion to adjourn? Motion, Ms. Rosano, second. Oh, that's a question. Oh, sorry.
Not for the commission. At the last legislative meeting, the OT and the PT people and speech therapists addressed this body and were concerned that they had received a raise since 1982. And I was wondering if anyone is going to, are we going to pursue it? Are we going to look into that? Because if they're not being paid, they're not going to contract with us, and the kids are going to be the ones who are going to lose out.
We actually already have that information for you. I can get it to you after the meeting, but their statements were not quite accurate.
Is that something that would be under the purview of the Social Services Committee?
No.
Oh, okay. Only because it affects
Potentially, I mean,
the children, and that's why I thought this was the appropriate, but
It's not for us, certainly.
What committee would have jurisdiction?
I mean, it potentially could be, or it could be a different committee for that purpose. It really depends.
Well, yeah.
It's something that's no longer before us, so I can certainly send you the information that we have found out, but.
Well, thank you for bringing that up. Sorry, you want to say
I could
something?
just add, I think it is, if not directly, but it definitely is relevant to this committee's, because I know as a foster parent, the services are provided to foster children. And I know in my case, because of the shortage, my fourth son was not able to receive the services that my third son did. And because of that, now he has intensive physical therapy and has to wear braces, and all because the early intervention we just couldn't make happen because there was no. So it is a huge issue.
if we don't get it early, if early intervention doesn't take place, everything is delayed and children starts off behind,
Very much so.
which impacts the rest of his educational career or, something.
Yeah, thank you, Ms. Rosano, for bringing that up. I think it's something that's very important that we should address. They actually reached out to me, sent me an email with some additional information as well, and I'd be curious to see what information we've been able to find, but I think it's something we should look more into.
Thank you.
Yes, motion to adjourn. Second? All in favor? Okay, meeting's adjourned.